22-year-old Muhammad Jalil fled with 8 members of his family into Bangladesh in September when the Myanmar military and Buddhist groups attacked their village. Muhammad's one of a growing number of refugees being trained in basic medical and rescue skills by an Australian voluntary organisation.
If I can eventually go back to Myanmar, I would like to use my training to help people there, train others in these skills.
With aid agencies so focused on meeting food and sanitation needs for the refugees, there's often not enough medics to provide basic health care or get to refugees living far from field hospitals. More than 625,000 Rohingya have come across the border in recent months, adding to the approximate 400,000 who were living in camps already, having fled previous military crackdowns. Rights groups say Myanmar soldiers killed hundreds of civilians and gang-raped women as they swept through Rohingya villages after attacks by a Rohingya rebel group in late August.
The reality is the medical services are based along the main service routes, so the main roads, and it means that the refugees who live quite far out, and we're talking 2, 3, 4 kilometres away from the main road, aren't able, or some of them aren't able or capable of making it to those services. So if we can train medics locally who are embedded into the community, not only can they treat some of the smaller ailments and illnesses and injuries, but they can also transport the ones that need hospitalisation.
Muhammad and his team set off to make their first rescue, accompanied by their trainers. They've been told an elderly man has suffered a back injury around 20 minutes walk away. Abu Basa is suffering severe pain in his lower legs. He can barely walk. The medics think he may have injured his spine. As the volunteers prepare the stretcher, other refugees gather around them asking for medical help. 7-month-old Mustaqim has dislocated his hip. If it's not treated, he may never be able to walk. So the volunteers are taking Abu Basa to the nearest road so he can be taken on to a hospital. There just aren't enough medical workers to treat the sick in this camp. The volunteers are being trained to work in an area where we understand there are around 100,000 families living. Having fled for their lives in Myanmar, they now train to save lives in the place they are forced to live. Charles Stratford, Al Jazeera, Thengkhali Camp, Bangladesh.